In her precordium, I am inspecting the aortic, which is in the right second intercostal space, the pulmonic, which is in the left second intercostal space, the Erb's point, which is in the left third intercostal space, the tricuspid, which is on the left fourth and fifth intercostal space along the sternum border. And lastly, the mitral, also known as the apical, is at the apex, and it's the fifth intercostal space on the left side. There's also the point of maximal impulse. So I'm inspecting. I don't see anything abnormal, symmetrical, normal findings. I'm going to begin palpation, and I'm going to look at the chest wall. I'm looking for heaves and lifts with the finger pads, and I'm going to be looking for bruits with the balls of my hands. And I'm going to be assessing those at the aortic, the pulmonic, the Erb's, the tricuspid, and the mitral. No abnormalities found. No bruits found. Next, I'm going to auscultate. The aortic, the pulmonic, Erb's, tricuspid, mitral, and the point of maximal impulse. Normal findings, S1, S2. Next, I'm going to have Kayla stand up. We are going to inspect her abdomen. What we are looking at is the skin color, the surface, the contour, the movements of her abdomen. She doesn't seem to have any scars, lesions, protrusions, masses, or stretch marks or dilated veins. The color is consistent with her ethnicity, normal movement of the abdomen. The contour is round, flat, non-distended. It's symmetrical without any bulges or abnormalities. The aortic pulsation that's in the epigastric area is a little hard to tell. I can't see it, but if it was present, it would be a normal finding. Next, I'm going to auscultate. I'm going to listen to the vowel sounds in all four quadrants. No abnormalities heard. Vowel sounds in all four quadrants. Normal clicks and gurgles. No, nothing abnormal heard. I'm also going to listen to the aortic and renal arteries for bruits. No aortic or renal bruits heard. Next, I'm going to percuss, and this is to assess the distribution of gas in the abdomen and to identify any masses that might be present that are solid or fluid filled. No abnormalities found. Next, I'm going to do a light palpation in all 4 quadrants, and I'm going to be pressing about 1 centimeter deep, and I'm going to have Kayla, I'm going to ask her to cough, and I'm going to have her breathe through her mouth with her jaw dropped. And this is important because I want her to relax, because if she's tense, then I may not be able to find what I'm looking for. So I'm going to do the light palpation. What's it called? Now I'm going to be doing a deep palpation, and it's going to be about 2 to 3 inches deep. I'm going to have her cough. I'm having her cough to assess for any peritoneal inflammation, and I don't seem to be able to find any. Lastly, I'm going to palpate her liver and her kidneys, and for that, I'm going to have her lay down flat on her back. And I'm going to try and palpate her liver by putting my left hand back here, my right hand on top. And I'm unable to feel it, but nothing abnormal is felt from what I can tell. I'm going to do the same with her kidneys. No abnormalities felt. And that concludes this assessment. Thank you.